Okay, and we are live. Welcome everyone for a special CME lecture on this Saturday evening. Thank you very much for joining us. Tonight we have a very special guest speaker, Dr. Timothy William, who is a consultant physician specializing in infectious diseases. He's my colleague at Subang Jaya Medical Center, and he will be talking about something, a new kid on the block, which is a pioneering vaccine for dengue. Okay, this is the scourge of our country, and now that the COVID pandemic has settled, dengue is rearing its head again. Okay, now before I will go on to the lecture, I just want to go through some housekeeping slides. We would like to invite you to join us on slido.com. If you have the Slido app already, you can go to 21600059, or else you can scan this QR code with your normal camera, and it will take you to the Slido website and the event. Okay, so we prefer you to use Slido for questions. If you can't, you can use the live YouTube chat also. We will highlight your questions. Now, just to get you familiarized with Slido, we will have a pre-talk poll, and just one simple question. Would you consider taking the dengue vaccine yourself? Okay, and I've activated the poll, and if you can all go to Slido, and if you can please answer the poll question. Let's see if the Slido is working. Let me check it myself. Okay, so you just select the your choice and click whether it's yes, no, unsure, or if you have already taken it. Okay, let me display some results here. Keep on voting. We've got about 31 votes. Let's see a bit more before we move on. 36 votes. Can we see 50? Like an auction, yeah. Majority are still unsure. Yes, 37. Quite a few have already taken 23%. At least nobody has said no. Okay, let's see after the talk whether those on the fence or are unsure will be swayed one way or the other. Okay, the poll is still live, and carry on voting. Okay, now you can claim CPD points after the talk. Now, this talk for doctors, I will display an attendance link, and this will take you to a registration form, and then we will upload your points to the MMA. Now, nurses and pharmacists also have expressed interest. So what we'll do is we'll display a separate link after the doctor's one. We'll give you another link. And in this link, when you submit it, you will automatically get an email reply with your attendance certificate. Okay. So that would be at the end of the talk after the Q&A session. Right. Now, please subscribe to our channel if you're on YouTube. So please, this will help us propagate the video and also keep you informed of our upcoming events. And don't forget to like the video as well if you find it beneficial. Okay, let's, without further ado, I'm going to bring on the streaming of the pre-recorded video by Dr. Timothy. Okay, so it'll be about 40 minutes. So I hope we'll have your undivided attention.
Good evening, everyone. I would like to thank Dobbs and for inviting me to give this talk and webinar. And I also like to thank Takeda for sponsoring this talk. So the topic of the talk today will be pioneering dengue prevention through vaccination. There's a bit of disclaimer. The name of the vaccine is Qdenga, and it has received registration approval in Malaysia to prevent dengue fever in persons aged 4 years and above, regardless of previous dengue exposure. So our DCA requires all recipients of Qdenga to be included in a registry for surveillance purposes by the NPRA. So for more information on the registry, you need to speak to the Takeda representative. And as an invited speaker, I'm also receiving honorary from Takeda Malaysia for this presentation. Okay, let's start. Now, dengue fever cases are increasing globally. If you look at the year 1970 to 79, it's a bit hard to believe. Globally, the cases that were reported were only 100,000 globally. And as the years have gone by, up to 2023, there's about 4.2 million cases of dengue reported as of October 2nd. In 2019, we had 5.2 million. I still remember in the 1970s and 80s, 70s especially, when Malaysia first started having dengue cases, we had the number of dengue cases appear on our television screen, just like the COVID cases. Today we had how many cases of dengue and how many deaths. And now we have far more cases than we could ever imagine. The prevalence of dengue is actually very likely underreported. In fact, it is underreported. Official passive surveillance systems do not always capture the subclinical infections, and outbreaks can be misattributed to more than 10 other febrile illnesses, including malaria, influenza, and COVID-19. Most people with dengue actually do not know that they have dengue. So, for instance, you may realize when you're managing cases that there are a number of cases who come in with a dengue IgG that is positive. And when you ask the patients whether they had dengue before, they say they can't remember having dengue. So the vast majority of cases of patients who have had dengue are asymptomatic or very mildly symptomatic, that they don't even present in the emergency department or in the hospitals. So 75% of people with dengue are asymptomatic. Now, what is the significance of the asymptomatic people who then get dengue who are asymptomatic? Well, they are the main carriers of dengue. So they contribute to the silent virus transmission, because if a person is asymptomatic or mildly symptomatic, they're out there in the environment, and mosquitoes have increasing opportunities of biting them and spreading the virus to other people. And you have about the next stage of this pyramid is a non-severe dengue and febrile illness, about 96 million dengue infections, and they manifest in the usual way, with fever and all the other signs and symptoms of dengue. And finally, you have dengue, severe dengue, which is the tip of the iceberg, where globally there are about 500,000 people who develop severe dengue. One person actually dies in every 25 minutes, which is high. Now look at the dengue incidence in Malaysia in 2023 and 2022. The trend is upwards. If you look at 2019, we had 130,000 cases of dengue. Interestingly, if you look at 2021, our cases dropped because of the COVID pandemic. And after that, it started to rise again. In 2023, it's gone back to 123,000. And as of March, 31st of March, there's already 44,000 cases in Malaysia. So our numbers are going up again. Why the numbers of cases have dropped during the COVID pandemic is actually very interesting, because dengue is only transmitted by mosquitoes from humans. When there are no humans, there's no dengue. So during the COVID pandemic, people are less out and there's less contact between people, and people are less out in the environment. So the opportunity of spread is much more less. And so you can see a drastic drop in the number of cases in 2021, and now it's increasing again. Now, dengue transmission. The cycle of mosquito to human transmission continues until the level of immunity in the human population breaks the infected cycle. So I want you to see here, this is the dengue virus, the lipid membrane, and you have the RNA genome and structural proteins. So I will divide this structural proteins and non-structural proteins. Structural proteins comprise of capsid proteins, the membrane protein, and the envelope protein. So the uninfected mosquito, Aedes aegypti, then bites a person who is infected, and often this infected person is asymptomatic, not even realizing he has dengue, and then the mosquito then gets infected with dengue virus, and then in turn bites other people and then transmits the virus. What are the factors that can increase the risk of severe disease? Comorbidities are very important. Patients with cardiovascular disease, respiratory disease, old age, renal disease, stroke, diabetes, and allergies, and also co-infections with other diseases such as COVID-19, malaria, and many others. Interestingly, also, you do see patients without any comorbidities presenting with very severe disease. Secondary infection, meaning to say that a person is getting dengue for the second time, can also increase the risk of severe disease. And I like to stress, many people don't even know that this is a secondary infection. So this is through a phenomenon called antibody-dependent enhancement, which results in a more severe disease caused with secondary patients who experience a second infection with a different serotype and are at a greater risk of severe dengue or dengue hemorrhagic fever. Now, the anti-dependent enhancement phenomenon, so to speak, is one of the major concerns in the in the dengue vaccine being used. The question is whether this a person who's been vaccinated is at risk of anti-dependent enhancement. Well, I'll discuss more about this later. So all this is another slide by the Ministry of Health, kindly provided by Dr. Shahrudin. As you can see, the different dengue serotypes as dengue, then 1, then 2, then 3, and then 4. Up to recently in 2022, then 4, the serotypes then 4 reached to a maximum was the predominant serotype, but then it's come down, and now the predominant serotype is now then 2. So these are the dengue virus serotypes, then 1, then 2, then 3, and then 4. And there's no cross immunity between the serotypes, meaning to say it's possible to get infected with dengue virus multiple times throughout the life. A second infection with a different strain can increase the risk of severe dengue. And just because you get dengue once, it doesn't mean that you cannot get dengue again. However, you won't get dengue from the same serotype. A vaccine can be an essential part of integrated dengue control and management. Indeed, it is in many, many diseases. So when we talk about dengue management in the community, it involves epidemiology control, integrated vector management, the environment, patient care, laboratory, and now we have a extra armamentarium, that is the vaccine. Once a dengue vaccine is available, regional and national strategies should require its introduction be within the framework of an integrated management strategy dengue as future component that will contribute effectively to the achievement of its objective. So a vaccine is a very important component in the control of any infectious disease. And we have waited for long last that we have this vaccine, the dengue vaccine. And now it's not the all end and be all of solving a problem, but it remains it's going to become hopefully a very important component in our dengue management. This is a classification of vaccines, just a review. So the dengue vaccine is actually a live attenuated vaccine, which is a vaccine that's alive but made to be inactive. Okay, inactive. Then you have an inactivated vaccine where the vaccine is actually killed. And then you have the fractional subunit vaccines. You have protein-based, non-recombinant or recombinant, polysaccharide, toxoid, and then you have the nucleic acid vaccines, the mRNA vaccines that we are familiar with. So what is a dengue vaccine? The Qdenga vaccine design, Qdenga was developed using an attenuation and recombinant techniques and constructed considering all four serotypes. So as I mentioned just now, the dengue virus contains structural proteins, envelope protein, membrane protein, and a capsid protein. So the dengue vaccine, the dengue virus consists of these three proteins, the C, M, and E structural protein. So the backbone of this vaccine is provided by the DENV2 virus. Okay, so you have the dengue 2 virus that is attenuated or made inactive, and the DEN2 provides the genetic backbone. Okay, it provides a genetic backbone. So the genetic backbone is provided by the DEN2 virus, and then you can see the dengue substructural proteins E, M, and C. So what it does is it includes the vaccine is designed to combine the M and E proteins of the DEN1, DEN2, and DEN4. They combine it into the this DEN2 genetic backbone. So this DEN virus is actually a chimera that contains the envelope proteins, membrane protein, and capsid proteins of the DEN2, DEN1, DEN2, and DEN3, and DEN4 serotypes. So this is actually known as a chimera. If you want to know, a chimera comes from a Greek mythology of a flame-breathing monster, flame-breathing monster, where the head is a head and the body is a lion, and then you have a cow and a snake as a tail. So this is like a chimera. So it's one vaccine, one virus, that's the DEN2 virus, but it also contains the envelope proteins and the structural proteins of all the other serotypes. So Qdenga is designed to activate a broad range of cellular and humoral immune response to the dengue proteins. So you have the innate immunity. The data that we have suggests that Qdenga activates the interferon response, so the innate immune system can target host cells for destruction when they recognize the dengue antigens on the cell surface. And then you have the adaptive immunity. So it is understood that the T helper cells then stimulate B cells to produce IgM and IgG antibody, which gives the longer term immunity and rapid protection against the dengue serotypes. And then next you have the cellular and humoral immunity. The dengue-2 backbone of the vaccine is thought to elicit a dengue-specific NS1 antibodies, and these antibodies then block the membrane permeability mediated by NS1. So a robust clinical development program which spanned 19 phase 1, 2, 3 clinical trials involving 28,175 participants, 88 study sites, and involving 13 countries. So the name of the trial is TIDES, TIDES, which stands for Tetravalent Immunization Against Dengue Efficacy Study. This phase 3 trial demonstrated that there was a 80.2 overall vaccine efficacy in preventing BCD, or virologically confirmed dengue. So I'll be using this term BCD. BCD stands for virologically confirmed dengue. A 90.4% reduction in hospitalizations due to VCD fever, And the vaccine efficacy varied between dengue serotypes. I'll speak more about it. So different dengue serotypes showed different dengue efficacy levels. This is important. No pre-testing of serostatus was required. So overall, Qdenga was generally well tolerated. Qdenga is the first dengue vaccine with 4.5 years of phase 3 clinical data at the time of approval. And again, I'd like to repeat, it's indicated for the prevention of dengue disease caused by any dengue virus serotype in individuals from 4 years of age. So the TIDES of DEN 301, the rationale, objective, and the study design. Just want to share the study design. It's 12 months. They look at the primary endpoint. So the participants received 2 doses of the vaccine, 3 months apart. At 12 months, the overall efficacy is, the primary endpoint was the overall efficacy against dengue of any severity and any serotype. And then the secondary endpoint ranging from to 18 months, wanted to look at the efficacy by serotype, baseline serostatus, and severity. And then they went longer after that, another 36 months to look at the long-term efficacy and immunogenicity. And then after a further 25 months to look for any booster evaluation. So weekly contacts and detection of both hospitalized and non-hospitalized dengue cases were sought. Febrile illnesses with serotype specific RT-PCR or dengue case confirmation, and also they wanted to look at serious adverse events. Subject of 4,000 reactogenicities, unsolicited adverse events, and additional immunogenicity. And we also had they also had active febrile illness surveillance to detect both hospitalized and non-hospitalized dengue cases. So what are the endpoints? The several efficacy endpoints assess protection against virologically confirmed BCD. Okay, so again, this is just a repeat. Part 1 is 12 months, part 2 is 6 months following that, and part 3 is 3 years. So the long-term efficacy, Qdenga achieved 80% overall vaccine efficacy against virologically confirmed disease caused by any serotype at 12 months. So the overall, as you can see from this graph, at 12 months, the overall vaccine efficacy was 80.2%. And then at 18 months, it's 73.3%. At 36 months was 62%. And at 54 months was 61.2%. So this are quite good results. Further exploratory analysis of 36 and 54-month follow-up data also showed that there was a 65% vaccine efficacy in seropositive individuals and 54.3% vaccine efficacy in seronegative individuals at 36 months. I just like to highlight there is a difference between seropositive individuals and seronegative individuals. However, unlike the previous vaccines, you do not need to know the serostatus of the patient before the vaccine is given. And there was a 64.2% vaccine efficacy in seropositive individuals and 53.5% at 54 months. So the Qdenga achieved 90% efficacy against hospitalized dengue fever. Earlier, I was just talking about all cases of dengue. This is hospitalized dengue fever by any serotype at 18 months. So at 18 months, the efficacy of the vaccine against hospitalized dengue fever caused by any serotype was 90.4%. At 36 months, it was 83.6%. And at 54 months was 84.1%. So this is a graph. I just want to explain to look at the cumulative incidence of BCD cases according to baseline serostatus. So you see the dotted lines here in pink, and the dotted lines here in blue. So these are the ones with the Qdenga vaccine, and these straight lines are the placebo. First of all, you note as time goes by, the incidence of cases uh, uh, with those with the Qdenga vaccine compared with the placebo, there's a difference. Okay, this is without the with the placebo, the numbers are much more higher compared to the ones with the Qdenga vaccine. And within the Qdenga vaccine, those that were zero, those that were zero negative had a higher incidence of cases compared to those that were Qdenga that were seropositive. Okay, seropositive. So the overall efficacy of the vaccine in preventing BCD, 80.2% at primary endpoint. So the overall vaccine efficacy from 1 month to 12 months after the first dose was 80.2%. Overall vaccine efficacy from 1 month to 18 months, not 12 months. Now 18 months after the second dose was 73.3%. And then now at 54 months, the overall vaccine efficacy from the first dose to 54 months after the second dose was 61.2% vaccine efficacy. But we look at the primary endpoint, which is what we want to know, what is the most important part of the study. Most accurate is at 12 months, the vaccine efficacy was 80.2%. What about the long-term protective efficacy against hospitalized BCD, regardless of baseline serostatus? So the cumulative incidence of hospitalized BCD cases according to baseline serostatus. So again here, the dotted lines are those with the Qdenga vaccine, and the straight lines are those with the placebo. And you can see the difference is quite marked between those who are vaccinated with the Qdenga vaccine and those who were given the placebo. So the overall efficacy of the vaccine in reducing hospitalizations due to BCD fever caused by any dengue serotype, 90.4%. This is the secondary endpoint from month 1 to 18 months after the second dose. And so in raw numbers, 13 out of 12,700 hospitalized cases had the Qdenga vaccine as compared to 66 out of 6,316 in the placebo group. And in the exploratory endpoint, 84.1%, as this we are looking at 54 months, the efficacy was 84.1%. So the primary and secondary endpoints were analyzed in the per protocol population, and the cumulative incidence and exploratory evaluations were based on the safety set data. I just want to give you the WHO 1997 DHF criteria, of which the study was actually based on. When they wanted to look at the severity, they used the WHO 1997 DHF criteria. So these are the DHF criteria, just for in case many of us would have forgotten. Fever, hemorrhagic tendencies, thrombocytopenia, and evidence of plasma leakage. So Qdenga demonstrated an 85.9% efficacy against DHF. Now, I'd like to just make a note of it. There were insufficient numbers of cases using the DCAC criteria, the Dengue Case Adjudication Committee. So while they were able to look at the number of dengue cases and number of hospitalized cases, and when we look at the efficacy against DHF, it demonstrated an 85.9% efficacy. However, the number of cases was small. Okay, the number of cases was small. So although intuitively we can say that it's effective in reducing the risk of DHF, but the number of cases in the study was very small. So there's insufficient number of cases. But just looking at this small number, we can come to two conclusions, which would require actually further study, to be honest. One is Qdenga had lesser the number of cases with DHF was less compared to those with the placebo, although the numbers were small. But the other thing I'd like to point out is among those who had DHF, if they had antibody dependent enhancement, then you would expect those who have been vaccinated to have a higher risk of having severe dengue, which which wasn't seen in this trial. So indirectly, we can say that indirectly lah, we can say that AD in this trial didn't seem to be a problem in those patients that were vaccinated with Qdenga. Still, I say the number of cases were low and did not allow for statistical evaluation. So the second endpoints, Qdenga was efficacious against dengue fever in both seropositive and seronegative children up to 18 months of follow-up at the end of part 2. There is 76.1 in those who are seropositive and 66.2 in those who are seronegative. And vaccine efficacy by infecting serotype. Now, the vaccine efficacy varied between the serotypes. I just want you to highlight this, just so that you understand. Just remember just now I showed you the slide of the different serotypes. So then too, as you can expect, because that's where the base of the vaccine was based on, is the efficacy is very good, 95.1. But then when you look at DEN 1, it comes down to 69.8, DEN 3, 48.9, and DEN 4, 51%. So the efficacy varies between serotypes. So let's say the predominant serotype is DEN 2, then the vaccine efficacy is 95.1%, which is very good. On the other hand, if the serotype is not DEN 2, let's say DEN 3 or DEN 4, then the efficacy is not as strong as if it were DEN 2. Okay, so vaccine efficacy remained inconclusive against DEN 4. So it's inconclusive. So DEN 4 is inconclusive because they are due to the low number of cases. Now, there's a reason why I'm stressing on that. If you look at this graph, DEN 1 blue, DEN 2 in orange, DEN 3 green, and DEN 4 purple. If you look at 2021 and 22, the highest number of cases were actually DEN 4. Okay, DEN 4, of which the efficacy was 51%, and the study was not very conclusive. Okay, because there were very low number of cases in the study involving DEN 4. So DEN 4 in 2022 was the highest, but now at this moment in 2023, 2024, the predominant serotype is DEN 2, okay, of which the efficacy is 95.1%. So it does make sense because the serotypes change at different times, different periods of time. So it's trying to predict. It's difficult to predict, but eventually the serotypes will change as time goes by. How will the use of the vaccine, widespread use of the vaccine, affect the percentage of serotypes in the future remains to be seen. We'll just have to wait for further research. What I mean is, if many people are using the dengue vaccine and you reduce the number of DEN 2 viral infections, would that mean that there will be more DEN 4 serotypes coming up? Well, that's something that for us to think about. So vaccine efficacy was shown against all 4 DEN serotypes in baseline seropositives and against DEN 1 and DEN 2 in baseline seronegatives. So again here, there's some caveats here. So for all serotypes, if the baseline is seropositive, vaccine efficacy was shown, okay, if the serotype is positive. So DEN 1, DEN 2, DEN 3, DEN 4, if the serotype if the patient was seropositive, meaning to say IgG positive, definitely vaccine efficacy was shown. Okay. Now, if they were seronegative to start with, vaccine efficacy was definitely shown in DEN 1 and DEN 2. However, DEN 3 and DEN 4, as you can see this uh, line, the vaccine efficacy was for those that were seronegative, was not very significant. Was not significant. So seropositive, yes, everyone was it was effective. Seronegative, not so for DEN 3 and DEN 4, definite for DEN 1 and DEN 2. And whereas in hospitalized vaccine confirmed disease, it was a bit different. Both seropositive and seronegative, it showed vaccine efficacy for regardless of the serotypes and regardless of whether they were seropositive or seronegative. But however, DEN 4, a robust assessment was not really possible. As I said, the DEN 4 in the study that they did, they didn't have many cases of DEN 4. So you can see a very, very wide confidence interval for DEN 4. So immunogenicity, the seropositive rates against all 4 serotypes remain above 90% up to 15 months after the second dose of Qdenga. So the antibody levels were high after 15 months, after the second dose for all the different serotypes. Okay. And also look at the immunogenicity. Immunogenicity. Qdenga was generally well tolerated. The most common adverse reaction in the clinical studies were mild to moderate and short duration of 1 to 3 days. It's very important whenever the new vaccine is coming out, people generally want to ask you whether it's safe or not, okay, whether they'll suffer any side effects or not. So this is a pooled safety profile analysis of 14,627 participants from the age of 4 to 60 years, which is quite a big, large number. So most of the side effects are mild to moderate. The most frequently reported reactions in subjects between 4 to 60 years were injection site pain, headache, myalgia, injection site erythema, malaise, asthenia, and fever. Adverse reactions were less frequent after the second injection than after the first injection. And the frequency and type of severity of adverse reaction in children were consistent with those in adults. Qdenga had a minor influence on the ability to drive and use machines. So, in conclusion, actually, for the tolerability, there were no important safety risks observed up to 4.5 years after the second dose of Qdenga. Similar cumulative incidents of serious adverse effects were observed for individuals treated with Qdenga and the placebo. And there was no evidence to date that Qdenga enhanced disease severity in seronegative individuals. I mentioned to you just now regarding antibody-dependent enhancement, and there's no evidence of that at all. So these are solicited systemic adverse events from the phase 3 trials: drowsiness, irritability, loss of appetite, and fever. They look at these symptoms, and they did not show any difference between those who took the Qdenga and the placebo. And Qdenga demonstrated a generally well-tolerated safety profile during the follow-up period as well. So were there any severe adverse events, any related adverse events? There was none. There's no related adverse events. And any serious adverse events leading to discontinuation of the trial is the difference between the Qdenga and the placebo. There's no significant difference, both for the baseline seropositive and the baseline seronegative. there was only 9 out of 9,663 cases in those who took who were seropositive, and 2 in 3,714 cases. And this was not much different from the placebo. That's baseline seropositive 9 in 9,663 in the seropositive, and compared to the placebo is 5 out of 4,854, which is not, and baseline seronegative is 2 out of 3,714 and 1. Now, SAE, serious adverse events, doesn't necessarily mean that the serious adverse event was due to the vaccine. It just means that something happened during the period of the study. It may not be related to the vaccine itself. So there's no difference between the vaccine and the placebo. Qdenga has been approved and available around the world, including Malaysia, and there are some other countries that approved but not yet available. So it's available now in Malaysia. So the vaccine is administered as a 0.5 ml dose at 2-dose 0 and 3 month schedule. So dose 1, 0.5 mils, and then dose 2 is at also 0.5 mils at after 3 months. Okay, after 3 months. So a bit on the formulation, it's stored at 2 to 8 degrees Celsius. The shelf life is 18 months and administered immediately within 2 hours. There are two. There's a syringe that contains the active component, that is the attenuated Dengue 2 virus and the 3 chimeric viruses, then 1, then 3, and then 4. And then it's injected into a lyophilized vaccine vial and reconstituted, and then it's given subcutaneously by a subcutaneous injection 3 months apart. So this is the dosing schedule at 0 and 3 months. So in summary, Qdenga is administered as a subcutaneous injection in 2 doses, 3 months apart. So this is one of my last slides. So Qdenga helps protect your patients against dengue, indicated for prevention of dengue disease caused by any dengue virus serotypes in individuals from 4 years of age, regardless of previous dengue exposure. It protects against dengue, 80.2% overall vaccine efficacy for 30 days after the second dose until the end of 12 months. Follow-up, 90.4% overall efficacy in preventing hospitalized dengue due to VCD fever from 30 days after the second dose until the end of the 18 months. And the second one, it provides long-term protection up to 4.5 years, 61.2% overall vaccine efficacy against VCD up to 4.5 years, and 84.1% overall vaccine efficacy against hospitalized dengue up to 4.5 years. And there's also a sustained geometric mean titers of neutralizing antibodies against the dengue virus serotypes after vaccination with Qdenga up to 4 years. I mean, when we say that there's a sustained neutralizing antibodies in the body, it sort of infers that these people are vaccinated are still protected against dengue, but it's not been proven yet by clinical studies yet. Generally, it's favorable. It has a favorable safety profile and well tolerated. So there were no important safety risks observed up to 4.5 years following the second dose. No evidence of enhanced disease severity in seronegative patients. This is what we will get asked often. Is there any risk of ADE? There's no evidence. And no pre-testing of serostatus required. You don't need to test and see whether they're IgG positive or not. And in clinical studies, the most frequent reported reactions are injection site pain, headache, myalgia, injection site erythema, malaise, asthenia, and fever. So with that, I'd like to thank you very much for your kind attention. Thank you.
I forgot to mute myself. So thanks for staying with us, and it's time for the Q&A, and I'd like to invite my good friend Dr. Timothy to the stage. Hi, Timothy.
Hi, Alan.
Yeah, people are enjoying your talk, so that's Yudhishthira saying good talk, Tim. And there is some questions coming in from Slido, so I think I will switch to that right now, and we'll start with the oldest questions and then move on to the later ones. Okay. So the first question in Slido is a booster dose required for the vaccine?
Yeah, so far a booster dose is not been recommended for the vaccine yet. They are currently doing some. They've started doing some studies to see after the 54 months has been completed on whether the booster is needed or not. Actually, from my understanding from the study is that after 54 months, the antibody levels were still high, and the efficacy still remained at a satisfactory level. However, that's not an answer that has been. I mean, there isn't an answer yet for that question whether a booster is required or not.
Okay. So, but it's good protection at almost nearly 5 years, huh, so far. Yeah. Second question from Dr. Chia: were subjects and placebo groups matched for age and seropositivity?
Yes, the subjects were matched, but at a 2-to-1 ratio, where the vaccine groups are 2-to-1 for the placebo.
Yeah. I think it's a good trial, being placebo
Yes.
control, but there was 2-to-1 in the randomization, so they were matched. So the next question: if a patient comes back after 66 months, that means delayed. You said it's from 3 months. Normally, is the second dose. What if it comes back at 6 months? Do we need to repeat the first dose?
No, we don't need to repeat the first dose if the patient has missed the third month schedule for the second dose. So they can just take the other dose.
Okay. Uh, Another question from Dr. Sia this time. If the patient has dengue fever, how long do we wait until we vaccinate?
Yeah, so that's a very good question, and the answer is actually based on the other dengue vaccine that's then Vexia. The CDC actually has recommended that we wait for about 6 months after the dengue fever has occurred, because the wild type dengue virus antibodies are still there. So that's what the CDC has recommended, about 6 months after person has had dengue.
Hmm. Yeah. Somebody has asked you in YouTube, have you taken the vaccine? Any side effect they experienced personally?
Um, yes, I have taken the vaccine. I'm due for my second dose in October. So far, still alive. Um, yeah, but I did not really experience any side effects other than the injection site pain, which was hardly there anyway, because it was actually given
Mm,
subcutaneous. It's a subcutaneous injection, so it wasn't that painful, at least from my point of view.
yeah.
And the question, uh, yeah, sorry, I didn't see the whole question. If yes, any side effects you experience personally, if not, why not? I don't know why I didn't suffer any side effects. But if you look at the study, at least when they compared the side effects of the placebo and those who are vaccinated, the side effects weren't much different between the two groups.
Yeah. Let's see if there are any other questions in the Slido. Yeah. What is the impact of administration of Dengue on reading on the dengue test kit, if any?
Um, I think um, I, I, I don't really know the answer for this question yet. But I presume that the dengue IgM and IgG may be positive. I'm sorry, I can't give you an answer for this, but I think the antibodies will be, uh, with references, I think the antibodies will be positive. So as you can see from the study, it is given when they compare the two groups, those who are seropositive and those who are seronegative. Those who are seropositive, the vaccine efficacy was better than those who were seronegative. And you don't need to do, I mean, I'm sidestepping now, and you don't need to do a dengue serology test before administering the vaccine, compared to the previous dengue vaccine where you needed to do a dengue serology before administering the vaccine.
I've consulted authority uh, known as Chat GPT, and the answer is not known to significantly interfere with routine dengue testing, but can complicate certain diagnostic tests, which in particular those that detect antibodies. So if it's a PCR based test like viral RNA, then it won't be affected by vaccination with Q dengue. Uh, and antibody-based serology, the Q dengue stimulates the immune response and can result in positive tests on serology, such as dengue IgG or IgM. Mm. So this test, which detect antibodies rather than the virus itself, can be challenging. Uh, I think that's what Dr. ChatGPT says. We've got any? Can you hear me, Timothy? I
Yes, I can
think.
hear you clearly.
Yeah, yeah. Sorry. Yeah. Okay. So would the vaccination interfere with NS1 testing? So
Again, I can't definitively give an answer for this, but theoretically, I think it should not interfere with the NS1 antigen testing because we are trying to detect antigens, and the vaccine produces antibodies. So I can't really answer that question. I mean, I can just give you a theoretical answer.
yeah. So my reference says again, since the NS1 antigen is part of the virus itself, vaccination with Q dengue does not interfere with uh, NS1 testing. So,
Yes.
in your opinion, who is the ideal candidate for the vaccine?
The ideal candidates for the vaccine, and this from the recent WHO uh, SAGE recommendations. They recommend those between 6 to 16 years of age for the vaccine, and those above that, if they have any significant comorbidities. That's number one. And number two, they recommend the vaccine, especially in high areas with high intensity of dengue transmission.
Okay, that is that refers to almost all Malaysians, right?
Yes.
Okay, so,
Yes.
so can the vaccine be co-administered with other vaccines? If not, what is the interval recommended?
From the vaccine here, they actually say it can be co-administered with other vaccine. There's no real interval recommendation.
Okay, uh, what can PL HIV with UVL? So this is probably ID speak, which I don't understand. Take Q dengue vaccine safely.
I think PL is people living with HIV with undetectable viral loads, undetectable viral load. So presuming they have a normal CD4 count, can they take the dengue vaccine safely? The Qdenga vaccine is a live vaccine. It is not recommended for people who are highly immune suppressed. So the there's no recommendation. They just recommend they actually recommend that people with HIV and on immunosuppressives who want immunosuppressive agents who and also people who have other immunosuppressive diseases, they don't recommend giving the vaccine. They haven't had any caveat on people with HIV with undetectable viral loads. So it's not to be fair, although theoretically it should be safe. Officially, it's not recommended. Okay.
What about my patients, say those with autoimmune disease on steroids or immunosuppressants?
Yes, then
Can
they,
they
they
have the
shouldn't take
vaccine?
they shouldn't take the vaccine, yeah, because it's a live vaccine.
Hmm.
I mean, it's not
Okay.
recommended. It's contraindicated.
Hmm. What is the best age group encouraged for vaccination? I think you
Yeah,
mentioned
and
that.
the answer yes,
Uh,
yeah.
so in Malaysia, it's 4 years and above. Yeah.
Yes, I just referring to the WHO recommendation that is between
Hmm.
6 and 16, 6 and 16 years.
But I think the info is it's approved in Malaysia for 4 years and above. Is that right,
Yeah,
Tim?
4 years and above. Yeah, yes.
Okay. Um, one question: do we get lifelong immunity after being infected with a particular virus strain? So I presume this is referring to natural immunity. And can a person get infected with the same strain multiple times?
No, yes. I mean, if we are infected with one particular strain, we do have immunity against that strain. Now, the question is whether we have life long immunity. It's difficult to answer that question, to be honest, because we don't really test the strain of dengue on uh, a patient who is infected. But generally speaking, if you are infected with a particular strain, for instance, DEN2, then you're very, very highly unlikely to get infected with a DEN2 uh, virus strain again. So whether it's lifelong or not, um, we I can't really give you an evidence-based answer lah. Okay.
Okay. Subcutaneous vaccine, what size needle to use? If it's too long a needle, it'll become an intramuscular injection. Any problem? Let's say if it's accidentally given intramuscularly.
Yeah, I think it's a 25 G needle, and I think the vaccine comes with the needle itself also, the vaccine set.
Okay.
Yeah.
Melanie asked the same question about immunocompromised patient, like our transplant patient. So it's a live vaccine. I think Timothy, you answered it's contraindicated.
Yes.
Yeah, okay. I mean, the question then, if the immunosuppression is very mild, let's say ITP only on like 5 milligrams of prednisolone, could you weigh? Because we have patients on it and who are worried they get dengue, they already have low platelets, you will crash. So some of them cannot stop the steroid, but they're on very tiny doses. What do you think of those sort of patients?
I think those patients can be vaccinated. Um, Again, um, we I mean when they say a person is immunosuppressed, they don't really say the degree of immunosuppression, isn't it? They just
Yeah.
mention the patient is immunosuppressed. So it's a bit difficult to answer that question because if we go against the vaccine manufacturer guidelines, uh, regardless of what I mean, they don't tell us, you can give the vaccine if the prednisolone dose is 5 milligrams or 10 milligrams, or don't give it if it's only 60 milligrams. So they don't really mention it. So I, I personally would recommend the vaccine if they're on very low dose immunosuppressives. but we do need to also inform them and get an informed consent for the vaccine
Okay.
to be given. I hope
Yeah. Yeah.
that answer would, that I hope that's a reasonable enough answer.
Yeah, I think it's a conversation we need to have with our patients,
Yes.
and probably something where we will need more data as time goes on. Hopefully, we'll have more answers. The next two questions are fairly similar. How long does vaccine last in the body? Data is only 4.5 years. Do we need to repeat the vaccine like after 5 years? Efficacy after 3 years, repeat dose needed. So, same
Yeah, it's a question
questions.
of whether the booster is needed.
Mm,
Um, so they are doing studies now to see whether it's needed or not. So we don't have an answer for that yet, whether people need a booster. As of now, they don't recommend a booster after 5 years.
okay. So currently, no booster is
Yes.
recommended or needed. Yeah. Okay. Got some more questions. If we give vaccination within 6 months of somebody having dengue, any risk, side effects, or problem with efficacy?
We give the vaccination within 6 months of dengue. Um, so far, no, they haven't seen any side effects.
Okay.
They haven't seen side effects. And the recommendation I was giving is actually based on the WHO, no, sorry, the CDC recommendation for the Dengue,
Mm, mm,
earlier vaccine.
okay. All right. Chiho is asking the same question, so we'll skip that. There's one. How confident that the tetravalent approach of dengue provides balanced immunity for all four serotypes, particularly in patients who are dengue naive?
Yeah, so the study shows, and the WHO also put up a statement for then one and then two serotypes, there's definite efficacy. Then three, efficacy has not really been shown, and as the study showed, for those who are seropositive, for then three, it does show efficacy, but for those who are seronegative, the then three, it does not show efficacy. So the study divides into two, the seropositive and the seronegative. Now, for then four, the numbers are too small to make a uh, make too small to say either way. So that's the difference between the different serotypes.
For seropositive patients, how did the investigators identify the serotype associated with their previous investigation, in previous infection?
For how did the
I think this is a research laboratory, so they would be able to,
yes,
yeah.
yeah.
Hmm. How much is the vaccine? It's a
Um,
dollars and cents questions. Yeah.
this I could just got the information. Price ranges from 240 to 250 ringgit per dose.
Okay. So that's comes to close to 500 ringgit for the course, right?
Yes.
Okay. And when most of the above 4 years are vaccinated, will the vulnerable unvaccinated younger than 4 years be at higher risk of getting the infection?
Well, I mean, it's like this. I'm not based on the study alone, but the idea is the vaccination is part of just one. It's one important component in the strategy of controlling dengue. Not the all and the end all. It's one.
Mm,
So um, if the vaccine can reduce the number of people who are infected, and when I say infected, those I mean those who are symptomatic and those who are asymptomatic, which forms the largest proportion of people who are infected with dengue. If we reduce the number of people who are infected who are asymptomatic, then they also there's also theoretically less carriers of the dengue virus. And when there's less carriers of the dengue virus, then it means that the spread of dengue, the dengue transmission, will be lesser as well. So
Okay.
the answer to that would be if it's used community wide, and of course there needs to be studies henceforth as part of the overall strategy of reducing the number of dengue. The idea is we will reduce the number of people who are infected with dengue, and hence
Okay.
reduce the transmission of dengue.
So the question which I was waiting for has finally come. And what is the key feature that prevented dengue from causing potentially severe second dengue, the so-called antibody dependent enhancement effect, which we saw with the Sanofi vaccine, isn't it? Why does it not occur with the Q dengue? And is there a potential for this in the future with virus evolution?
Um, Actually, I don't know the answer to that question on why it didn't occur. Um, I, I well, we'll have to find out. I don't think the study has actually told us why it hasn't occurred.
It is probably something to do with the viral backbone and the innate
Possible.
difference
I mean,
structurally compared to the other vaccine.
yeah.
Mhm.
I mean, the other
Yeah,
vaccine, the viral backbone is the yellow fever
yeah,
vaccine, whereas
yes.
the Qdenga vaccine, the viral backbone is the serotype 2
Mm,
virus. We don't know whether that causes that reduction on
mm,
ADE or not.
yeah.
Um,
Okay. We are past time, so just a few more questions. Contraindications for the vaccine. I think we mentioned immunocompromised. Uh, I think also pregnant and breastfeeding mothers. I think in the literature. So immunocompromised, pregnant, or breastfeeding mothers. Total of
yes,
3 doses given
pregnancy as
accidentally.
well.
Will there be side effects if accidentally give an extra dose? They will be super immune against dengue. Okay.
Yeah. So no data yet on whether the third dose is given, but we need to report it on whether there is any side effect or not.
What? Yeah. One last question. Okay, I have to stop here. How does the cost with adults older than 16 who live in non-dengue endemic areas who are not in WHO recommended group for vaccination? Mm,
So adults older than 16 who live in non-dengue endemic areas who are not in W recommendation. Okay, so I think what it means is if you're above 16 and you don't have any comorbidities, is there any benefit of taking the vaccine or any contraindication of taking the vaccine? I think there's no there is no contraindication in taking the vaccine, but I think there's a benefit of taking the vaccine in the sense that it reduces the risk of getting dengue and the complications.
okay. How does the cost effectiveness of 2 dose Qdenga regimen compare to other potential dengue control methods like vector control programs?
Dengue, as you see, as I mentioned earlier, the vaccine itself is part of the entire strategy of managing the dengue pandemic. So it's just one of the components in dengue management and dengue control. So it's not a question of whether it's more cost effective or not. It adds another component to our dengue control measures.
Okay. Uh, Don't know what RVD patient is. What is an
HIV,
RVD patient? Do you
HIV
know?
positive patient take the
Oh,
vaccine.
retrovirus disease. Yeah, we mentioned
Yes,
that already.
yeah,
Yeah, yeah.
yeah.
No, unless. So you want to summarize it? Can the RVD patient take the vaccine?
No, so far it's not recommended. It's contraindicated.
So,
Yeah,
yeah, and also contraindicated in pregnancy and
yes,
lactating mothers. Okay.
yes,
All right. I think we have to call it a day with the Q&A. Thank you very much for all your interesting questions. So we will come to the claiming of CPD points. I'll display an attendance link uh, for the doctors as well as for paramedical colleagues, nurses, pharmacists, etc. Just a reminder, please subscribe to our YouTube channel so you'll stay informed about upcoming CPD events. So I'm going to show the post-stock poll. Let's see whether there's any change or not from there were substantial, I think almost 30% of you who were unsure. So let's see whether Dr. Timothy has convinced you all to take the vaccine. So can we just have at least 50 votes before we move on to the CPD? Okay. Thank you very much for voting. Unsure has dropped to 0, but Timothy,
yes.
you've you've made some you converted the no to 11%. I don't know. Unsure has dropped. Yeah, the yes have increased substantially from 50% to now two-thirds. Yeah, yeah. Maybe the no accidentally clicked the no. You can still change your vote. Yeah. Unsure is very low now. Yeah, 8%, 65%. Yeah. Thank you. Can continue to vote. Yeah. While we go on to the claiming of CPD points. Now, this is the link for the doctors, not for nurses or pharmacists. For doctors, you go to dops.my/121024. That's today's date, in case you didn't realize that. Or if you use your camera, this is not the MMA app, please. This is your camera or QR code scanning app. It will take you to the same link. Now, this link is just an attendance form. So you need to fill in your details and you'll go into our spreadsheet, which we'll upload tomorrow. So you will get your points for attending and watching uh, in the upload tomorrow. I'll announce it in the DOPS forum. If you did register but did not get your point, please let me know. Now, we cannot be leaving this form active indefinitely, but there'll be a way for you to claim points even after the live stream is over. And what you need to do is to make a comment in the YouTube video that you have confirmed that you have watched it, and then we will respond to you and tell you how to claim the point. Okay. Let me know in the comments if the form is working for you. Yeah. Yeah. Okay. So if the form is working for you, please give yes or just let me know some feedback. Uh, okay. Let me check myself. Yeah, I think the form should be working. So, all right. Now for the nurses and pharmacists, um, you can use this attendance form. You go to dops.my/npattend. Okay, the QR code will take you to that same link. There's no upload of any points. What this does is when you submit your attendance, the system will email you an attendance certificate. So hopefully that will be useful for you to claim CPD points. We can't also leave this form active indefinitely, so it will be valid until midnight tonight. So even if you're not watching this live, if you caught this a bit later and you're still watching, you can still claim your attendance certificate right until midnight of today. So so I think we come to the end of the session. So thank you very much for staying with us right to the end. I'd like to thank Timothy once again for his excellent talk and fielding all your questions. And I hope you've have your main worries answered or main concerns addressed. And I think it has been a very insightful talk, and I think we all learned something new. And I hope that this is a important weapon we have in addition to the epidemiological and public health methods to combat dengue. At least we now have a highly effective vaccine which works for almost 5 years. So in 2 doses, age 4 and above. Okay. So any last words, Timothy? Otherwise, thank you once again, and thank you, Takeda, for sponsoring the talk and at least making it possible. And we thank you all again for attending. So we will end the live stream in a few seconds. Okay. Any last words for us, Timothy?
Uh, Thank you very much, Alan, and
Yeah.
also
Yeah.
Dobbs, for organizing the this talk, and also Takeda. And thank you to
Okay.
all the audience for your kind attention.
Yeah. Thank you, everybody, for your watching and your kind participation, and most important, ask questions. Okay. So we'll see you in the next one. And good night and have a good weekend. Yeah.
Good night.
So the stream has ended, but we are still on the stage. Yeah. Okay.